Right. So now we are going to talk about mental health nursing subject. So when we consider mental health, it's a specialized area in nursing. So uh, uh, so we'll discuss about the introduction related to mental health nursing today. So when we consider mental health, here are the objectives that we are going to talk. So we will talk about what is mental health, then mental health problems, then the role of the mental health nurse. So when we consider mental health, so the successful adaptation to stresses from the internal or external environment should be there for a good mental health. So if people have good adaptation for the stresses, that means they have a good mental health. But if they can't tolerate, that may be causing reduction in the mental health of those people. So when we talk about further, so the thoughts, feelings, and behaviors that are appropriate uh, in some people for the situation, but if the mental health condition is not good, in a good condition, so the thoughts, feelings, and behaviors can be changed. So especially there are thoughts, firmly held thoughts considered as delusions, uh, especially uh, grandiose delusions, persecurity delusions. That means some kind of fear situations like persecution, and some people may have feelings and some hallucinations also, misbeliefs regarding different situations. So if they have normal thoughts or feelings, that is considered as a good mental health. But if the condition, that means thoughts and feelings are different, that is are considered as some disorders in mental health. As well as the behaviors, they are normal people have normal behaviors for the situations, but if it is abnormal, that may be due to mental disorders. And regarding the congruent with local and cultural norms, congruence means compatibility. So if the people are compatible with the condition, so that is called as congruency. So if it is not matched, that is called incongruency. So we called congruency with local and cultural norms. So we have to consider that in a mental disease patient, so that will not congruent with the situation. There may be some changes. So interfere with social, occupational, and physical functioning. So if the person is having a mental illness, they may reduce the social, occupational, and also physical functioning, as you all know. So when we consider social, sometimes they are having some social withdrawal symptoms. They are not talking to the society. Then when we consider occupational, sometimes they will get some conditions. That means they don't have proper communication with the community, and physical functioning will be reduced also in different condition of mental disorders. So good people, I mean, without mental illnesses, they don't have these bad interferences, but if they have reduction in the mental condition, they may face different situations. So when we consider mental health problems, there are different things we will talk about in future slides regarding these matters. So therefore, you will learn about different conditions in future lectures. So we'll talk about mood disorders, especially depressive or bipolar affective disorder. So that means mania, mania situation and also depressive symptoms and disorders. And we will talk about what are the nursing care related to depression disorder and bipolar affective disorder. Here you can see some interesting pictures. You can refer this PPT in the Moodle. Then here you can see some symptoms of the depressive condition: can't sleep, can't concentrate, sadness, so guilty. So these things you will learn in future lessons also. So therefore I am just explaining what will be learned. Then bipolar affective disorder is another condition that present mania and the depression both. So both conditions can be appeared in that mania and the depression. So that is another bipolar affective disorder. Then schizophrenia is another dangerous disease condition when we consider worldwide. So it has mainly delusions and hallucinations, that means psychotic symptoms. So in future we will learn about this condition also with treatment plans and nursing care for these kind of patients. Then they have some, especially suicidal, deliberate self-harm and suicidal actions can be present in these patients. And also when we consider depression, they also having this kind of symptoms, and we will talk about what are the actions, what are the nursing care can be given for those patients. Then the substance abuse when we consider. So, sometimes alcohol abuse, heroin addicts, and different substances, cocaine, cannabis. So, there are very bad side effects uh, and psychiatric conditions will be faced by the population. So, we'll talk about that also in future. Then there are some eating disorders. So, some psychiatric condition. You can see two different people. Some are eating more and some are not eating. So different eating habits. So we will discuss that thing in future lessons. Then anxiety disorders are there. You will have heard previously also. There are different anxiety disorders. So here you can see some pictures. Then child psychiatry, especially we will talk about the attention deficit hyperactive disorder, and also some other psychiatric conditions that can face in the childhood. So finally, the dementia and Alzheimer's disease, those are also considered as psychiatric disorders. So there are some lessons related to these areas also when we consider psychiatry. So dementia is a kind of degenerative disorder in the brain function with the forgetfulness and all. So you want to know the nursing care and what are the treatments available for this situation. So finally, we will talk about in every and each lesson. So you'll be able to learn regarding the nurse's role on development of the patient's condition, and also we will talk about ECT, that means electroconvulsive therapy for as a treatment, and the other treatment plans available for to relieve the situation. So those are the things that can be mentioned as an introduction. So in future sessions, we will be able to discuss about more regarding the sessions and the nursing care available for the different conditions. Thank you.